Hi, I'm Dr. Catherine Snow, and let's go through the steps of an embryo transfer. Let's head to the procedure room. So, Haley Green, our social media marketing strategist, is being our fake patient today. In the setting of an embryo transfer, we'd come into the procedure room just like this. The patient would lay down on the table, and she would have a full bladder. The reason we need a full bladder is so that we can perform an ultrasound on the belly and watch the uterus on the screen right there. Before we do anything, our embryology team would perform what we call a timeout. Say hi, embryology.
Hello.
This is McKenna, and before we do an embryo transfer, she would confirm the name of the patient, the time, date of birth,
Procedure, and anything else that would identify the patient before we proceed.
This is to make sure we have the right patient and the right embryo. Mary, say hey.
Hi.
Mary would then help by performing an ultrasound on the patient's belly so that we can see the uterus. Over here, we have the tools that we use for an embryo transfer. First, we use a speculum so that we can see the inside of the vagina and find the cervix. Next, we use what we call a flushing catheter, and this would flush the cervix of any mucus so that there's no resistance or issues at the time of the actual transfer catheter placement. Lastly, we use an embryo catheter that looks like this, and what's neat about this catheter is it's sort of a placeholder. So once we get this catheter into the correct spot, which we're able to see using the ultrasound, we can take the inside of the catheter out, and McKenna, or whoever is in the lab that day, would bring in the embryo and fish that embryo through this outer sheath of the catheter. We then look at this on the ultrasound and confirm we're in the right spot of the uterus. And that's it.